All right, well, welcome everybody. It's good to be back. Kind of feels like a long time, but then not really. Feels like just yesterday. Well, yeah, actually, I was teaching yesterday. um, so it's good to be back. See a lot of familiar faces, a lot of people continuing. Just to kind of learn about how to walk on the second leg of our system, right? The first leg being Shanghanlun. Did 10 weekends on that, lots of information, lots of different angles, new things, old things. And now we're going to see about the second leg of our system, which is the Jingui, more complex diseases, the typical kind of weird stuff, I would say, right? I mean, when Zhang Dongjing called it Jia Bing, Jia means complex, Jia means just a little bit of everything, very complicated, very weird stuff. And if you thought, I mean, from a certain perspective, it's easier to learn Jingui because the Jingui uses a lot more being the whole disease differentiation way of thinking, right? This disease has these types of formulas to treat it. And then you just have to kind of figure out how you diagnose this disease. And then of this disease, already by virtue of knowing what disease you're dealing with, you already kind of have a very limited selection already. You've already eliminated a lot of stuff, and you're like, well, there's just a few things left that I need to differentiate between, right? If you say, oh, obviously this is a jaundice, person sitting in front of you, all yellow, sclera is yellow, urine is dark, all that stuff. Oh, this is a jaundice, right? And then you think in your mind, okay, which jaundice formulas do we have in our system for which different types of jaundice? And then you kind of have to use your pulse and other differentiational skills and come up with the answer. So it's a little easier. So it seems. Because actually, there's going to come a time, and especially you will experience that when we start talking about Jingui pulse diagnosis. There's going to come a time when you feel, wow, I long for the old days of Shanghanlun pulse diagnosis. Because in Shanghanlun pulse diagnosis, you know how we did this nice and neat, kind of almost black and white exact science like Guizhi pulse, Ganjiang pulse, Dahuang pulse. It's very crisp, it's neat. Oh, I have a Guizhi pulse, a Chaihu pulse, Chaihu Guizhi Tang, right? Simple as that, beautiful. That kind of disappears. I mean, it doesn't disappear, but it gets usurped in this bigger swamp of information because the pulses will not be as clear and as linear as they were in Shanghanlun. The differentiations also are not always as clear and as linear as they are in Shanghanlun. It's just much more convoluted. And the main reason why it's much more convoluted is because we're going to have to grapple with pathological product. The Shanghanlun is a purely functional dysregulation. And in a few instances, there is some pathological byproduct, right? The pathology creates a material byproduct that is pathological in nature, that is not something that's useful to you, or it's in the wrong place or doing the wrong thing, and then you need to get rid of it, right? Think chengqi tang, you have to get rid of dry fecal matter, or blood in the bladder, or those kinds of situations, right? But in the Shanghanlun, there's very few of those situations. In the Jingui, there's a lot. There's a lot. And so what did we see when we did like pulse diagnosis like the chengqi tangs and things like that, we realized that, oh yeah, sometimes the pulse can't show itself, like in water pathology. Sometimes the pulse can't show itself because there's so much water in the body suppressing the yang, and if the yang can't show itself, the pulse can't show itself. I mean, that of course has diagnostic value, don't get me wrong, but it makes it a little bit trickier to read, which in the Jingui is going to be quite common actually. There's damp, there's phlegm, there's tons of blood stasis, there's food stagnation, there's all kinds of pathological byproduct in the picture that is going to somehow alter the originally nice and clear and crisp pulse diagnosis system that we had in the Shanghan, right? So there's a lot more variables that have to come into play, right? But of course, that's why the course is kind of incrementally. Now, Shanghan Jingui, originally, per Zhang Dongjing, probably intended to be practiced and studied together. Nowadays in China, they're often separated, right? I mean, you can go to a Chinese university of Chinese medicine somewhere in China, and then, you can go to the Jingui department, or you can go to the Shanghan department, right? And the people who do Jingui mostly use Jingui formulas in clinic. Of course, they know Shahan, because how could they, for their own personal study, not know one and only study the other? Of course, they're going to do both, but they'll put an emphasis on one or the other. That's maybe not the way Zhangdongjing intended it to be, first of all. However, the fact that that's how they're doing it in China still shows us that it is possible to pursue one path more predominantly than the other. Therefore, when you take my training, obviously, you know, it's okay, because I'm saying this because some people kind of jumped in at the Jingui level. It's okay to start at Jingui. The way the courses are laid out, especially, you know, the pulses are going to be a bit more jumping off at the deep end. The rest is going to be very simple to follow, no problem. The pulses are going to be a little bit more jumping off the deep end because a lot of the theory behind Han Dynasty pulse diagnosis thinking and so forth was kind of transmitted during the Shahan pulse diagnosis. So that's the only thing where it's still, I mean, obviously tons of people do it all the time. And there's a lot of people who started with Jingui first and then ended with Shahan and do fine. But it's a little bit more, whoa, okay, this is a bit, all of a sudden you have to make quite a big leap there. So that's the only thing. Otherwise, you'll see it's quite fine. But Zhangdongjing himself, of course, I doubt that he would have practiced making very clear, strict separation, kind of like they would do nowadays in China. Nowadays in China, what they do is just, you know, it's just they separate the fields because that's just how they departmentalize everything, right? Everything is very hierarchical and departmentalized. So of course that's, you know, the way they do things. But Zhangdongjing didn't necessarily do that. Zhangdongjing, he just kind of organized the material when it came down to writing it down. He said, okay, there's two types of illnesses that are triggered by something from the outside, and then everything else. Right? That's basically where he's coming from. But in practice, I can only imagine, just looking at my practice, for example, you know, it's a mixed bag. You've got people come in with clear Shanghan only, you've got people come in with clear Jingui only, you've got people come in with both. They had a chronic Jingui problem, you know, let's say a chronic blood stasis or whatever, and then now all of a sudden they developed an acute Shanghan cold damage or whatever on top of it, right? And you might sometimes have to choose that, oh, I'm only going to treat one and ignore the other. Sometimes you're going to have to choose to treat both at the same time, because if you treat one too strongly, you might offend the other one, et cetera, et cetera. So you're going to have to be very creative, and that's why I say you're walking with two legs, right? You can, of course, some people might just hump on one leg really fast and efficiently, but actually if you have two legs, it's a lot better. It's a lot more stable, and that's kind of how we're built and what we're built for. So the same thing here is that we're going to practice the full scope of medicine, which means anything that comes your way, you're going to treat. You're not going to turn people away. What cases would you turn away? Veterinary cases, obviously. Although, in one of my graduates in my German group who graduated last year, he's a veterinarian, right? And his clinic, he's an MD for people and he's a veterinarian at the same time. So he's got 2 degrees. It's crazy. And I mean, was like you couldn't make up your mind or what? It's such a weird choice, right? But he's got a clinic where he treats humans and animals in the same clinic. Yeah, I mean, it's got like, I guess like for sanitary reasons, it's got like 2 wings or something. I don't know, you know. And he puts different lab coats on. I don't know. A furry one and a plain one. But yeah, so he's using it also on animals. So it's very interesting to see that. But normally speaking, of the 4 categories of medicine, right? You've got internal medicine, you've got surgery, you've got veterinary medicine, and you've got dietetics, right? Those are the 4 ancient categories of medicine. Zhangdongjing is the internist. He's not the veterinarian, he's not the dietitian, he's not the surgeon. So surgical conditions, something people come to you and their hand is hanging by a thread because they just got mauled or something, okay, then you want to send them to the doctor. But otherwise, you know, and if they come to you for dietary advice, I got nothing for you. I mean, Zhangdongjing at the end of his book has a bit of a list of prohibitions as to don't eat meat with red dots on it, or don't eat meat of an animal that died with its mouth open, and things like that. You know, so you have to imagine that in the context of Han Dynasty, wartime, the country is just completely in turmoil. People are infamised, they have no food, and they're just like walking through the forest, and there's like an animal, dead animal there, and they're like, can I eat this? Right? I mean, I can only imagine that you try to figure out, is this still edible? So he's got all these kind of things, like don't eat the meat of the horse, of the part that was under the saddle. You know, he's got all these pieces of advice for the people who don't know what's good for them or what not, because if you eat this, okay, this might have some type of toxicity, or don't mix this type of milk with this type of meat, and those kinds of things. But that's not that's not what a dietitian would be doing. A dietitian would be like, oh, you've got this illness, now I want you to choose this type of grain and these vegetables and make a porridge or something like that, right? That's different. So we don't do that. I mean, you could do that, but there's no information in this book about that. So obviously no surgery, and obviously no veterinary medicine either. Although, you know, some people give herbs to their animals. I'm not knowledgeable about that. Actually, there was somebody last year who does that, right? Holly does that, right? Yeah. I don't know if she does a lot of Shanghai formulas, or so. I don't know. Right. But otherwise, it's just we're going to treat the full scope of medicine, right? And full scope of medicine means anything that comes your way, you are the primary care doctor for the people in front of you, which means people come to you with a question saying, I am ill. How can you help me defend myself from this illness? How can you get me back to normal again, right? So primary care style medicine. It's actually not really specialty care medicine. It's really general medicine. It's a little bit of everything, right? We got some gynae, we've got some rheumatology, we've got some, you know, whatever, cardiology. We got a little bit of everything. One thing that's a little bit less represented, and I've mentioned this before also, is dermatology, and another one is psychiatry. So both dermatology and psychiatry are less represented. Now, problems on the skin are just nothing but another symptom, right? So it's a symptom. So there's plenty of talk in the text, like, you know, there's talking about itching, there's talk about discoloration, there's talk about swelling in the skin, there's talk about the growth of certain sores, there's talk about lesions in certain regions of the body, you know, those kind of things. So we do have methods to treat skin. It's just not very developed, right? Why? One may ask, it's not very clear. Probably a few reasons. Reason number one, I suppose, is because it's less lethal. When a skin condition becomes a lethal condition, it's a surgical condition, right? So that would have been for the doctor who, like the Chinese medicine surgeon actually is the one who treats boils and furuncles and carbuncles and fistulas and that kind of stuff. Like things that need to be lanced, things that need to be drained, that kind of stuff is in Chinese medicine considered to be a surgical condition. Chinese medicine, external medicine they call it, right? And skin is historically a part of external medicine. So as Zhang Dongjing is an internist, there's not a whole lot of stuff said about the external aspect, right? So that's one thing. Even when I was in medical school in China, external medicine, we had a subject called Chinese external medicine, right? And that was, I mean, it was like, I don't know, 50 or 60 credit hours or something. It was not a big class, but enough to kind of teach you all the different diseases. Some of them called zhou huang, some of them, you know, ju, necrosis, or fistulas, or like how do you treat that, what herbs do you use, right? And what types of drains do you use wicks that are impregnated with herbs and stuff like that, right? But that's a field in and of itself. Like I had one course on that. That doesn't make me a Chinese medicine, external medicine expert, right? That would be, in your undergrad you get one course, and then you go on in your master's to do 3 years of study only on that subject only, right? And then you do all these techniques in the hospital and things like that. So I never did that. That wasn't what I did. It was just like a survey, right? And traditionally, dermatology is under that. So that might be one of the reasons. The other thing is, I think, indeed, that it wasn't lethal. And the way what Zhang Dongjing was trying to treat and prevent is untimely death due to an illness that was either mistreated or treated, was not treated or mistreated or delayed treatment or whatever, right? So mostly internal medicine conditions is what he works on, right? So that's it, though. I mean, with our system, and I think also in the case studies that we did in December, I gave a few examples at least. I don't recall exactly which ones, but I'm sure I gave a few examples on the treatment of some skin conditions, right? I suppose we talked about some eczema. I suppose we talked about acne, maybe some psoriasis and things like that, right? So there are treatments that we can use our formulas. Right? It's just not an exclusive thing for us to focus on that. So we're still in the general medicine field, right? You go to your family practitioner, he can treat a number of skin problems, but there's going to come a point when when your family medicine doctor says, I'm going to refer you to a specialist, because this is I'm not sure about that. I don't see enough of these cases on a daily basis to be able to be really the one who makes the final conclusive diagnosis as to what this really is and how it is really treated, right? And it's a little bit like that in our system, right? Now, a lot of times you'll still be like your family practitioner who says, oh yeah, I know that, and you treat it. But sometimes it'll be, okay, I've tried and failed, and it didn't respond. And I have plenty of those skin conditions also. With internal medicine, I would say that there are no cases that I feel that I need to refer out. Maybe, if it's a real surgical condition, of course, there comes a point, actually, we were smiling not smiling in a bad way, but we were when I was in Chicago last week or 2 weeks ago, whenever it was, we had a clinic on Monday, and I think we saw maybe 6 or 7 uterine fibroids. We called it Fibroid Monday because it was unbelievable. And some of them we just had to say, this is too far gone. There comes a time when, if it's like this size, like the size of a pomelo or something like that, you're like, yeah, this obviously did not develop overnight. You should have started treating this a long time ago, and with herbs, it's not going to happen. There comes a time when you just have to refer them to a surgeon. I hate that as much as they hate hearing that, but it is the truth nevertheless, right? But otherwise, within reasonable expectations, most internal things you can keep in-house and treat, so. Yeah, and then the psychiatry cases, again, we treat a lot of them because we don't necessarily see a separation between mind and body, so it's all linked, right? If there's a deregulation of the mind, it means that there definitely is a deregulation of the body because, of course, the mind drives the body and vice versa, so there must be a chemical basis for that mental deregulation. There must be a chemical basis for it. So, of course, you can re-regulate that chemical balance, right? And so, again, a lot of them you can treat either as part of the overall treatment, or you can actually look and really see, I'm going to use this formula exclusively for psychiatric application, and that works as well, also fine. But again, there comes a point where some cases are beyond the scope of herbal medicine. And even when I read Dr. Tian's case stories, my teacher's case stories, he also sometimes he says, oh, this cannot be treated by medicine, and it needs to be referred, this person needs to talk it through. Like go talk to somebody, and you need a friend, or you need a family member, somebody to talk to, right? Because this is not within the purview of herbal medicine, right? So also there's going to be a place where we say, this is, yeah, you need therapy, you need something way more than just herbs, right? Now, I am very reluctant to go there easily. Same thing with skin, though. I'll try. If the patient allows me to try, I'll try, because it's hard to, who do I refer to? It's not that easy to refer to a person. There's not that many people out there with herbs who are really that good, and especially my paradigm, which is one of always protecting the fire, always protecting the temperature of the blood, always protecting the heart. A lot of dermatology, as practiced in Chinese medicine, is about cooling the blood and clearing the heat and reducing the fire, and that is kind of against my principle. So I'm very afraid of that, honestly am. So I will try as long as the patient allows me to try, but there comes a point, of course, where I also call it. Same thing with psychiatry. I will try. Like, there is psychiatry in here. There's lily bulb disease for certain types of vexation. There is mania and rage and anger conditions. There is hallucinations, and both auditory as well as visual. Like there's all kinds of psychiatric things in here. There's hysteria, all kinds of things that we can still treat. So there's a lot we can do, but there might come a point also when you refer out, right, where you just have to say, But like I said, I'm not prone to that, because too often in Chinese medicine, what does happen is that the skill of the practitioner is limited, and then they try a few things and it doesn't work, and then basically they blame the patient. Actually, Western medicine does that more and more now too, unfortunately. Oh, you've got some type of intractable pain, and they can't somehow figure it out where it's coming from or what's going on with you. Then they say, oh, we'll put them on an antidepressant. Happens a lot. It happens a lot. It's not really fair. We really got to be honest about that. It's not really fair, because it's just kind of, you're doing it for yourself. You're not doing it for the patient. As a practitioner, you'd be like, yeah, well, you're just not ready to get better. Or, it's not that my herbs are wrong. It's just like you're not willing to get better. No, if it's herbs don't care about that. Herbs are strong and they can go. That's why I practice herbal medicine. I've explained this to you before. It's about the most unilateral approach that as can be. The only participation that is required is that they swallow the herbs. Once those chemicals go into the body, you can't stop that. I mean, you give somebody Chenqi tell them, do not have a bowel movement. Tell them, no matter how strong their mind is, it's not going to happen. It's not going to happen. I had a patient the other day. I've been working with her for a while. She's a lot better already, but basically in her 30s, had a baby, and then 2 months after had a stroke. And then, of course, all this stuff, and she's got still muscle issues and neurologic stuff, but then also she's got all these meds that they now put her on, the standard regimen, a statin, and her sugar was high, so I don't know, metformin, and hypertension meds, and blood thinners, because the standard, right? If you have a stroke, they put you on the standard regimen, right? And then the doctors went really high on her, and also she had a lot of pain, so she then was on some type of pretty strong pain drug, so very constipated. So then they start giving her things for the constipation. And they were giving her enemas and Miralax and, tons of stuff. Not moving. Not moving at all. And so I was like, wow, that's, you'd think that Western medicine at least would have something to make you move, right? It was not moving at all. So I gave her Hopo Chi Wu Tang with foods in it, because I had her on a Gui Zhi Jia Fu Zi Tang to treat her shoulder twitching and things like that. And she was doing fine. So basically, Gui Zhi Jia Fu Zi Tang stayed the same, just Hopo San Wu Tang incorporated, and I took the Bai Shao out or something. I don't remember exactly. She was pretty cold inside. And all of a sudden, everything just started moving. So it's really interesting that even the regular laxatives and stuff like that, it doesn't mean because they don't work that therefore our laxatives don't work. The way it all works is different, undoubtedly different, right? So I don't know how I got to this case example, but that's kind of when the herbs are right, the stuff works. It doesn't matter on what it is, right? So don't write it off too soon and say, oh, I'm thinking my herbs are right and you're not responding, so obviously it must be your fault. That is not really true. In certain psychiatric conditions and people with mental emotional, that could be the case, right? In lily bulb disease, that's the perfect example of that, right? In chapter 3, we will talk about lily bulb disease, 白合病. And lily bulb disease is a vexation, restlessness, mental emotional condition. And then it says in there that no herbs have been able to treat this, right? And whatever herb this patient takes, they vomit it, right? So that's exactly an example of that. I saw that once in Seattle when I was teaching there, and then did some clinic there. Female patient who nothing they had given her, she would vomit it back up. Any herb would come back up, anything. And then ultimately, Lily Bulb was the thing that she wouldn't vomit up. So it was like neurogenic. It was like a nerve condition, basically. So still, also there, it is still possible to make a change. You know, but there comes a point where you refer out. So why do I say all this? Because it is a very large scope of practice that we have when you really walk the Shanghan and Jingui legs together. The things you can treat are almost, I would say, in our daily practice, almost everything, right? And only some severe, very severe psychiatric or very severe skin cases, maybe those you'd have to refer out, right? But you can treat almost everything. It is within the scope of being able to diagnose it with one of the diseases or patterns that we have in this book, right? Because as we saw, you know, we can make all these combinations, right? So that's kind of that. So what is really, I mean, okay, the Jingui, I'm not going to spend too much time on the history of the book. I think the Wiseman translation finally came out, for better or worse, and obviously for better. I was just trying to make a silly joke. I'm sorry. I have a very special sense of humor for the new people in the room. It's really funny if you get it. It's mostly funny to me, actually, I must say. Crack myself up all the time. Basically, Zhangdongjing, it used to be one book. It didn't used to be separate books. It was just called Shanghan, like cold damage and complex diseases. One book, right? And in the different scrolls, of course, the different content was in it. So scroll 1 was all the Shanghan, all the externally triggered diseases. And then scroll 2 was all the internal and non-external, non-internal stuff. And then scroll 3 were all the formulas. Right? That's kind of how the original was. The formulas and the ingredients were listed kind of as an addendum all in the back. Right? And then Wang Shuhe found it and re-edited it. And then he put the formulas and the modification methods and boiling methods directly beneath each line in which a certain formula was mentioned for the first time. So the first time let's say, Xiao Cai Hu Tang is mentioned, under that line, the Xiao Cai Hu Tang, ingredients, dosages, boiling methods, all that stuff, modification method will be mentioned. And then he'll never repeat that again. Like if Xiao Cai Hu Tang is mentioned in a consecutive line, he's not going to repeat all the ingredients. Like he already mentioned it the first time that formula appeared. So that's kind of how he did the layout of the book. What is the definition of a complex disease versus a cold damage? Well, we defined cold damage very clearly when we did Shanghan, right? When we did the basic patterns weekend, we talked about what is Shanghan. And then the Nanjing said, Shanghan, there's 5 types of Shanghan, right? Which 5 types? Well, there's wind strike, there's cold damage, there's damp warmth, there's warm disease, there's heat disease. Remember those 5? Which basically told us that actually Shanghan is the Han Dynasty term for external contraction. What we now in Chinese medicine would call Waigan, external contraction, used to be called in Han Dynasty Shanghan, cold damage. And he also explained why it was labeled with the word cold. Because cold, for a mammal, is a very dangerous thing. Right? Because what ensures the healthy functioning of the immune system? Perfect body temperature regulation, right? If your body wants to like start its immune system, like kick it into high gear, it'll actually have to elevate your body temperature, right? And it'll switch on all your immune functions and then do whatever it needs to do to fight off illness and so forth, right? In other words, it'll mount a fever. Fever is the basic response that the body will trigger. And the trigger happens at the emperor level, at the brain level, right? It's the emperor, the brain, that triggers that. So then, for a mammal that needs to stay warm to stay healthy, cold is actually quite dangerous because cold switches off your immune system and then you easily get sick. I'll give you an example. 2 weeks ago, I'm in Chicago. It was 9 degrees. I was just thinking about this morning because today's going to be like 80. So, in 10 days' time, I'm like a 70-degree fluctuations. So no wonder I'm a little bit congested. I'm like, why am I always sick? Oh, wait a minute. Okay, I know. Airports, airplanes, different locations. Okay, and next week I'll be in Stockholm, which is also going to be 9 degrees again. So never good. But anyway, so but what happened is, like, I was feeling tipped up. I go to Chicago. It was ice cold. I was stupid. I forgot my long johns, so I was just wearing my suit, and the ice cold lake effect winds were just blowing straight through my bones, right? And there's bugs out. There's bugs out all the time. They're outside right now, right? So I got a stomach flu, right? Normally I would have been fine. I would not have caught, but if my body had been able to keep its body temperature up, but I wasn't able to keep my body temperature up. I cooled off too many times. Every time outside, I got really chilled, and I got sick. And that's exactly that, right? It's not about the viruses and the bugs and stuff. It's there. Like, even your table, everything's got bugs on it right now. You know, it's like everywhere. Your hands, the air, everywhere. You know, there's no need to be freaked out by that. What you need is you have to be in a healthy, physiologically functioning state, which means healthy body temperature regulation, right? In a little while, the air conditioner is probably going to switch on. If you've never spent time in this room, most of you have, and you know what I'm talking about. If you haven't spent time in this room, what's going to happen? You're going to start feeling pretty chilled because it's a very finagly thing. It's very difficult to regulate, so you'll want to put something on, just like that. I'll put my jacket back on. Then it'll switch off, and all of a sudden it gets really stuffy and hot again, and I'll take my jacket back off. But that's how we regulate. So cold is the most dangerous thing to your immune system. That is the most likely one to switch off your immune system, right? And because of that, of course, you get sick most easily. So that's why external contraction is crowned by the name cold damage, right? Because that's the most dangerous one for human beings. So that's why the cold damage part of the book was all the diseases, different diseases. Could be a jaundice, could be a urinary tract infection, could be upper respiratory, could be just, deregulation with a fever and chills, just body temperature deregulation. Could be a headache, could be a sore throat, could be a loose stool, could be severe fatigue and somnolence, right? Could be cold hands and feet, even could be that roundworms that you originally had in your body all of a sudden start acting up, right? I'm just giving you examples of the 6 conformations, all triggered by a cold, an initial deregulation of your body temperature, dropping your immune system into a less than healthy, less than optimal state, and all of a sudden your functions just kind of go haywire, just like that, right? So that's the Shahanlan. The Jingui is going to be any disease that is not externally triggered. So it's going to be the non-internal and the non-internal, non-external ones and the purely internal ones. Now the purely internal ones, in the strictest sense, are emotions, which means that it wasn't the weather, it wasn't the temperature around you, it wasn't what you ate, although sometimes you eat something that makes you angry or something, some bad food, and like, God damn, can't believe I paid $100 for that, something like that. Maybe that gets you, if you have an anger issue, then maybe that the food actually made you sick, but it wasn't the actual food, it was the anger that it triggered. But most of the time, emotions just happen from the inside out, right? And most likely, you have a predominant emotion present in your existence because a deregulation of its corresponding organ, right? Let's say you're always worried about stuff, Obviously, you have a spleen issue, right? Too much spleen, as if it were, right? So it's likely that comes because there's either not enough fire in your body or there's not enough wood in your body. You never stand up for yourself, you never get angry with your situation and try to get out of it, right? You're never happy, right? One of these two can lead to you being into a too much worry state, right? So it's very difficult to decide which one is the chicken, which one is the egg. Does the organ dysregulation come first, leading to the emotion, and then that leads to other pathological symptoms? Or is it the emotion that comes first, leading to the organ deregulation, and then to the whole pathology unfolding? I think there's a case to be made for both. Ultimately, it doesn't matter because it doesn't change how you treat it, right? treat it the way, oh, it's this organ, well, I just treat this organ. And then the organ gets better and the emotion gets better, right? But that would be a purely internal cause. All the other ones in the Jingui are going to be non-internal, non-external. So non-internal, non-external is going to be diet, lifestyle, fright and scare, like somebody like startled you, or like the news of a death of a loved one. That could be a total cause for illness, right? Can you say it is purely internal? No, because there is a causality for it. There was a reason for it happening, right? I mean, obviously there was an event. So the event was external, but the reaction, the response to the event was internal. So that's also non-external, non-internal, right? Fright and scare, diet, lifestyle, you don't sleep enough, you work too hard, you have a very lopsided diet, right? You only eat Wendy's, never Burger King, something like that, Very lopsided, unhealthy. If you're gonna eat fast food, you wanna, have a balance between the different burger joints, right? Yeah, so basically, those will cause, could be a deregulation of an organ or something like that, and then you'll develop some type of illness because of that, right? You drink too much, develop a jaundice. That's what we call alcohol jaundice, right? You ate dirty food and you developed hepatitis, and we call it grain jaundice, right? Something like that, right? You sit on the cold floor too often and you develop dysmenorrhea, and the dysmenorrhea then ultimately leads to infertility. I mean, you know what I mean? Like those are all non-internal, non-external causes. But then you've got like one extra category that you can often see, which is actually a problem that is still triggered from the outside, but not starting at Taiyang, right? So you see problems where there's a wind invasion or damp invasion or cold or whatever directly on an organ, right? Cold directly on a body region, right? Body part, like cold directly on the abdomen, leading to abdominal pain, Fuzigengmitang, for example. Or wind strike directly onto the abdomen, leading to abdominal fullness and bloating, Hopochiwutang, right? Or, cold diet, I already talked about, like lots of raw and cold food over long periods of time, Dajianzongtang, I mean, so there could be like some cold from the outside that gets delivered. Well, the Dajianzongtang is actually, that's diet-based, that's different. So an external cold or an external damp or an external wind, but not hitting your Taiyang first. Or, as we will also see, the non-linear invasions onto Taiyang, right? Linear invasion onto Taiyang means Taiyang wind strike, Taiyang cold damage. Taiyang wind strike, Taiyang cold damage, whoop, in the Shanghanlen. We are all very clear on that. We're all experts on that by now, right? It starts on the back, it moves towards the front, then it moves inward, right? Taiyang, Yangming, Shaoyang, Taiyin, Shaoyin, Juin, like it kind of burrows down into your body, right? But it starts on the back, right? But what if a nonlinear invasion, for example, would be a cold damp onto Taiyang? Normally cold is the standard, right? But now it's two pathogens. Or wind damp onto Taiyang, right? That's already part of the Jingui. It's actually, you could still kind of see how the formulas look like Shanghan formulas, but they're not Shanghan formulas. They're Jingui formulas, because this type of disease is a non-linear thing, right? It's kind of like it's going against the rules. The rules are only fist punches and kicks. And now the guy in front of you pokes you in the eye. And you're like, wait a minute, that's not part of the rules. He's like, yeah, I don't fight with the Shanghan rules. I fight Jingui rules. Right? So Jingui is like, it's like atypical warfare. It's like non-linear. It's, it's like, that's why you need Petraeus to write a counterinsurgency manual. This is the counterinsurgency manual for non-linear atypical illness. True. I mean, that's really how it is, because Dangdongjing says, well, the standard is that it would play out like this. Taiyang Yangming Xiaoyang, Taiying Xiaoying Jue. Yeah, very nice and clean, crisp, black and white. You always know what's going on. All of a sudden, it's different. You're like, wait a minute, that was not what we agreed upon. And then nature says, like, well, it's not my problem. What you gonna do about it? Right? So that's why he wrote the Jingui, to treat those nonlinear atypical things. Right? So it should be a cold onto Taiyang, but all of a sudden, it's a damp onto Taiyang. It's a cold damp, or it's a wind damp. Right? It should be a cold or a wind onto Taiyang. All of a sudden, it's a heat onto Taiyang. Right? So those are all the nonlinear things. They are still external contractions, but they are nonlinear. And that's the thing that people always say is like, oh, you guys, you practice Shanghan Jingui. Oh, what are you going to treat? Cold, common cold? Common cold? Ha ha ha. You only treat common cold, right? Dude, like, you don't know how high the sky is, you know? 不知道天有多高, right? You don't even know how big our world is. Like, you just think that the Shanghan and the Jingui, they treat common colds. No, it's like, they, you know, like just like the thing with the Nanjing, right? Shanghan just means external invasion. You know, external wind, a hot wind, like a wind heat invasion or dryness invasion or whatever. Those are all things that we treat. They're just atypical presentations, right? So they actually are cataloged under the Jingui. Right? And we will see very clearly, chapter 2, that's what we'll start with, is that of the 5 of the Nanjing, wind strike and cold damage are what the whole Shanghan is dedicated to. And then the other ones, the damp invasions, the warm invasions, and the heat invasions are in the Jingui, in chapter 2. If you grasp that, you realize you can treat any external invasion. Any one. External damp, external warm damp, external cold damp, external heat, external warmth, external dryness, external wind damp, cold damp, warm damp, whatever. Doesn't matter. Whatever combination, you could figure it out, right? And actually, if we actually know that, and to be honest, like when you're looking at the Wenbing classics, and they're a measly 300 or 400 years old at best, but when you're reading those, like their external damp heat formula could be like a baihu jia zhu tang, like a baihu tang plus changzhu. I mean, isn't that Shanghan? That's Shanghan. Just even the addition of atractylodes is set by Dangdongjing. That even Dangdongjing does that. It's just that they change it up. Instead of plus baiju, they do plus changzhu because it's more damp transforming, right? But that's just pure Shanghan. And the way they treat Xiaoyang is still Chaihu based. Even if they start to change it and they say, oh, and then some school of thought are very much indoctrinated by Zhudanxi, oh, you know, we have to protect the fluid, so then they start to move away from Chaihu, they move to Qinghao, whatever. That's fine. That could just be because they lived in a different region, you know, where it's just people are more dehydrated or whatever. That's fine. That's possible. No problem with that. But the idea, the principle, all comes from Shanghan. So it's all included. It's all in here. If you are able to get to the bottom of it, there's really nothing you can't treat. And the things you can't treat, trust me, there's going to be very few people out there who can treat it. So when you feel like, man, I'm just not getting this one under control, like some type of condition. Like I'm never going to forget, I had this Lyme's case. And most Lyme's cases, I think, respond really well to our formulas. But then this patient just, I mean, you know, kind of like the brain gets affected. And this patient kind of went off her rocker. Like she was going kind of crazy. And imagine, like, I actually thought she was on drugs half of the time because she would almost like be hallucinating and things like that. And to my knowledge, and I asked the question many times, and of course you never know, they might lie, but I worked with her quite a while. I thought there was a trust there. Yeah, I think she was just kind of losing her mind slowly and gradually, you know, and like she would say, oh, look, my hand's on fire and things. I'm like, I don't see no flames, you know. And so I couldn't get it. I couldn't get it, you know. And I tried a lot of things, and I could not get it under control. And I had a clear read on the pulse. But then when I gave the formula, there was no response. So, and then the pulse would change, and I changed the formula, and clear read, boom, and then no response. So, but then you also have to know that very likely there's not, if you don't get it, knowing this system well, and you don't get it, unfortunately, there's not many people out there who are going to get it, right? So I mean, I'm just saying that because then you don't have to feel bad about yourself. Like, you give it your all, and then it's just possible that you encountered one of those cases that really nobody can cure, and those cases do exist, obviously, right? So keep that in mind. So the nonlinear external invasions are also under the Jingui, are in the Jingui. And then you have certain conditions where you see that maybe the initial illness started with a common cold, like a cold damage, right? You know, whatever, Taiyang or something like that. And slowly, more and more conformations got affected. And they all their physiology all started failing. And after a while, there's so many conformations affected that almost you would say, well, there's a problem on every conformation almost. Or on 4 out of the 6. Or on 5 out of the 6, right? I mean, there's plenty of autoimmune disease patients that come in that you see that I mean, you look at them and it's like, wow, they have all 6 of their conformations have something going on, right? Does that mean you have to treat it with a 6 conformation decoction? I mean, it doesn't mean, no. I mean, that might be not really, that might not catch on. The body be like, you know, you take a Guiji Tang and the Chenqi Tang and the Chai Hu Tang, Li Zhong Wan, Zhen Wu Tang, and then Wu Mei Wan, you put it all in one. If that was possible, then you could put any patient on that and everything would be fine, right? Obviously, that is not the case, right? So then you really have to say, okay, what is the main thing that I need to treat? So what we see in the Shahanlun is that some conditions are combined diseases, or what we call, so that's what we call 合并, combined diseases, or 并并, diseases existing alongside of each other, right? Coexisting diseases. The basic idea behind them is that a 合并, combined disease, is that there is a causality between the two. The dysregulation of one is causing the dysregulation of the other. Pathology of the one is feeding into the pathology of the other, fueling the pathology of the other. That's what we call combined diseases. Coexisting diseases are just that. They are existing alongside each other. They're not messing with each other. They're not causing each other. They're just both present in the body at the same time. In the Shanghanlun, we will go up to 3. We will describe up to 3, right? We call that 三阳合并, for example, right? Triple yang disease, the combined disease of all 3 yang conformations. They're feeding into each other, right? But never do you see anything spelled out more than 3. But in reality, it sure exists. And very often when you're looking at some Jingui formulas and Jingui pathologies, you start to realize, wait a minute, this actually has like 4 or 5 conformations affected. I mean, the example I always give is 鬼子小儿之母汤, right? You look at 鬼子小儿之母汤, 鬼子白芍生姜甘草 is in there, which means you got 4 of your 5 ingredients of your 鬼子汤, right? So obviously there's a Taiyang component. How do you know? Well, there's body eggs, right? Then you've got high dose of Xinjiang, high dose of Baiju. Those are dampness transforming herbs. So obviously there's a Taiyin dampness component, right? You've got Baishao Zhimu, which are both Jueyin herbs, right? Baishao for cramping of the extremities, difficulty stretching of the extremities, right? Kind of like Shayao Gancao principle, right? Zhimu, pericardium herb, vexation herb, those, although it's not used for that, but it's used for the swelling in the extremities, but it is nevertheless a pericardium herb, right? So you have a Jueyin component to it, right? You've got Fuzi in here. Clearly there's a Shaoyin component to the pathology, right? We're already up to 4 conformations, right? The only ones missing is Shaoyang and Yangming. Right? So you can see clearly that this is 4 conformations affected. But it becomes so complex to call it like that you just give it a disease name, joint disease, right? Digit and articulation disease, Li Jiebing. You just give it a disease name because you can't start calling it Taiyang, Taiyin, Shaoyin, Jueyin, Hebing. Right? I mean, it just doesn't make sense that way. It's not even, it didn't even come that way. It probably wasn't even linear. The development wasn't even linear anyway. It might have been an external cold and damp and wind affecting you at the same time, because that's what the Neijing says. Any type of B syndrome is the complex gathering of cold, wind, and damp at the same time. Right? So that's definitely atypical and definitely nonlinear. Right? So that's why these things you would find in the Jingui. Although very clearly you can see remnants of like a Ma Huang Jia Zhu Tang. You can see remnants of a Gui Zhi Fu Zi Tang. You can see Ma Huang Fu Zi Gan Cao Tang. You can see all those formulas in there. Right? So I mean, clearly it's part of that. But it's not linear, it's atypical. So you still don't call it like that. Right? If you say, well, Arnaud, what would be a simplex, if Guizhi Shao Zhumutang is complex, then what would be a simplex Shanghai equivalent of that? Something like a Guizhi Fuzi Tang, or a Guizhi Fuzi Chu Guijia Baizhu Tang, or a Gancao Fuzi Tang. Right? Those would be the simplex, more acute versions of Guizhi Shao Zhumutang, which is much more chronic. You see? So you see correlation, but it's not the same. So that's why some stuff, although you see parts of Shanghan in it reflected, actually you're looking at a Jingui thing. Right? So that's kind of what we're talking about. So that is kind of like a more broad definition of a complex disease. It's got multiple elements to it. Right? Some stuff actually is very much Shanghan-like, but not exactly the same. There's a little variable in play. Right? So that's kind of what I mean with that. Now, on a larger scale, like if we're going to like climb to the top of the mountain and look at the whole landscape of our medicine, then the 3 primary doctrines, and ultimately the 3 eternal doctrines of our medicine, no matter what they develop, they can come up with new theories, they can come up with whatever they want. The 3 primary doctrines of our medicine are yin-yang, 5 phases, 6 qi. Yin-yang are heaven and earth, night and day. 5 phases are earth. 6 qi are heaven. Right? The weather plays out in the sky. Right? And the 5 phases, the 5 elements are on earth. Right? Wood, fire. I mean, there's no wood growing in the sky. Right? There's no fire in the sky, although in Russia 2 weeks ago, there was some serious fire in the sky. That was quite amazing, actually. Yeah, so, but basically, right, so if the variables in nature are the 6 qi, then the constants in nature are the 5 seasons, or the 5 phases, right? The phases, the seasons are the same every year. When spring starts, when autumn starts, those seasons, that's always constant. But the weather is not constant at all, right? Summer always starts on the same day, but whether it's going to be a hot summer or a cold summer or a rainy summer or a dry summer, changes from year to year, right? So those are the 6 variables. So the Shanghan, both books, of course, talk about yin and yang, because when we're looking at the 6 qi that the Shanghan model describes, the 6 conformations, it is basically talking about how the changes in the atmosphere, in the air, right? The weather changes around you, how they affect your body. What is the interface through which they talk to the body? The 6 pairs of channels. And the 6 pairs of channels have a yin-yang nature. You've got yang channels and yin channels. Taiyang, yang channel. Yangming, yang channel, and so forth. Right? So the 6 qi exercise, like the body has 6 pairs of channels to basically detect the changes and reflect the changes of the 6 qi in nature. It gets damp outside, that gets all of a sudden noticed by the Taiyin confirmations. Right? And so and that's all Shanghan territory, Shanghan Lun territory. The Jingui is going to talk about all the internal stuff. It's going to talk about the earth. It's going to talk about the human aspect. It's going to talk about anything that affects not now the channels, but anything that interacts with your organs. Emotions, diet, stuff that you swallow in, that kind of stuff. Or a cold or a damp or something that doesn't hit you on the channels, but hits you on the organs. Right? Let's say, you could do, that's what they do in China when they develop animal models for experimenting, right? In Western medicine, I'm assuming they do the same thing. Chinese love that stuff. My God. They love developing animal models for experimenting. They will, for example, they'll take a lab rat and they want to develop an animal model for direct strike of cold onto the lung. And they'll actually take like a tube or something that blows ice cold air and attach it to the chest of the rat so that it doesn't blow on the leg or just on the chest. And they'll blow ice cold air on that chest for a while until the rat starts coughing. For real. And then they'll give it Shegan Ma Huang Tang concentrated decoction or something like that. And if the cough stops, Shegan Ma Huang Tang works for cold direct onto the air. That'll be their test. And then they'll have a control group where they'll put, cold air, but they'll give a different formula, and a control group where they put regular room temperature air, something like that. Welcome to the world of Chinese medicine. It's true. This is exactly. So that's how they develop these tests, right? So it is truly possible that indeed a strike could not hit the conformations and just hit the organs directly. Let's say you have a jacket on, right? You have a jacket on, and it's a button jacket, right? And you're in a hurry, you're outside, you're in a hurry with your jacket. So you put your jacket over your shoulders, right? And you just kind of button the top 2 buttons and you're running and stuff like that. But the bottom part is not buttoned. So actually your stomach's exposed and it's really cold and windy outside. You could totally have a cold onto your stomach. That cold air that came onto your stomach that your jacket was not bundled up on, totally. Why wouldn't it? And then that area cools off and that deregulates the stomach of the function of the stomach and becomes an illness, right? So that's kind of the basic idea behind it. So direct onto the organs. So Shanghan is based on this, is the model that uses the 6 qi and 6 channel theory mostly. Jingui uses 5 phases and therefore 5 organ theory mostly. That's the difference between those 2 books. Therefore, together, if you practice those together, you've got a medical system, a system for the practice of medicine, primary care medicine, for the application of Chinese herbs, right? That is completely based on the primary doctrines of our medicine. Yin-yang, 5 phases, and 6 qi. In action. Right? And then you can just extrapolate, right? Hollow organs versus solid organs. That's nothing but an organ, right? A phase, but it's yin aspect or it's yang aspect. It's excess aspect or it's deficiency aspect. All of the other stuff that came later, the 8 parameters, all the organs, all the theory about all the whatever tissues, all that stuff came later. Because it's actually all implicitly already present in the system. So you don't really need to, go the extra mile and think of all the nitty-gritty detail. No, it's all included anyway. Right? So that's kind of the difference. So yin-yang, 5 phases, and 6 qi are the 3 primary models, and Shanghan Jiabing Lun as a whole practices all of it. Good. Any questions so far? Then we'll just get started. Some things I'm just going to brush over because, not that they're not interesting, they are interesting. However, you can spend a lot of time on it, but you can also, I think it's also just stuff that you can read by yourself. I think we have a lot of material to cover as far as the diseases and things like that, which is ultimately more important. The first thing is called, when you're learning Jingui in China, this is like a paragraph that they always make you memorize. It's called the 17 sentences of the Jingui. It's kind of like this, like very, Jingui Shiqiju, you have to be able to just like rattle it off because otherwise you're not a good student. It talks about how Zhangdongjing, it proves how Zhangdongjing is kind of like practicing, what do we call that? The upper class physician treats future disease principle, right? He sees a liver disease, but instead of treating the liver, he treats the spleen. Oh my God, isn't he amazing? All right, okay. We know he's an upper class physician, and that's obviously nothing that should be too surprising to us, right? But anyway, so he treats the spleen, etc., etc. So it talks about using the flavors, right? It uses the flavors as the metaphor for herbs. It doesn't say what herbs you're using, it says what flavors you're using. Now, obviously I'm going to have some problems with this passage. The main problem that I have with this passage is that it uses the symbolic flavors as outlined in the Neijing, for example, chapter 5 or something, where it just talks about, the flavor of the fire element is bitter, the flavor of the wood element is sour, you know what I mean? That kind of stuff. Which is not the way we looked at flavors. We looked at a very dynamic functional model, much more based on chapter 21 of the Neijing, which is also in line with what the decoction classic was talking about, right? Where we say, okay, the main categorical flavor for the wood element is pungent, the categorical flavor for the fire element is salty, the categorical flavor for the earth element is sweet, etc., right? So we used more dynamic, functional way of looking at the flavors and using the flavor model, right? But this is using the symbolic flavors. So that's why it's a little bit weird. Because it says, well, you tonify with sour, you assist with burnt, bitter, and those kind of things. Now, it doesn't actually say that sour here is used to actually tonify the liver, which is how a lot of commentators interpret this line. They say, in liver disease, tonify with sour. So it's almost like it says, tonify the liver with sour. It doesn't actually say that. It might, as far as I'm concerned, in liver disease, tonify the lung with sour. Because tonify the lung with sour, it suppresses the liver and you can get the liver disease under control. Because liver disease otherwise is going to spill over onto the spleen and damage your spleen. Right? So kind of from that perspective, right? So if this line, I personally kind of look at it as a Sinisan or like a Baisha-based formula. Like Sinisan could be a fit, Tang could be a fit, right? And then using the dynamic flavors, it still makes sense. But at face value, this kind of goes a little bit too simplistic on the flavors. Like we by now have talked about the flavor model in way more intricate and advanced ways compared to this, which is kind of just a symbolic flavor, a bit more simplified, right? Anyway, what I derive from this is that, one more thing is that, so did Zhang Dongjing write this or not? Like nobody knows. Like we don't know. There is adulteration of the text. But what do we do? How do we deal with the adulteration? How do we deal with the many passages that might not have been written by Zhang Dongjing? We study them anyway. Why? Because if any ancient physician deemed it useful, necessary, valuable to add a paragraph or to write something and put it into the original manuscript. Not the original manuscript, but put it into the manuscript that they were transmitting in their own lineage, because that's basically, this is an underground lineage, right? Then actually, I think it is worthy of our investigation and our study. Because it'll enlighten us, it'll, again, show us different aspects and teach us things about this classic that we're so interested in, right? So we don't know if it was written by Zhang Dongjing or not. It all doesn't matter, because what it does tell us is that people who practice this medicine, whether Zhang Dongjing or the other consecutive ancient physicians who practice this medicine, look at things from a flavor perspective. And that's, to me, that's already right there is a very valuable statement. Obviously, if flavors weren't important, or if they weren't looking at herbs like flavors, they wouldn't be having a passage like that, whether it's by Zandongjing or not. So flavor model is the ultimate way of studying herbal medicine, because it puts you at such a high level, because the flavors are the driving forces behind the actions of the herbs. So instead of just knowing the action and memorizing those, you actually start to understand why a certain herb has a certain action. And that's like standing at a much higher plane. Right? So that's kind of what I would say about this. Otherwise, you know, pretty straightforward stuff. Does somebody have the Jingui, that Wiseman Jingui on them?
I do. I have the Wiseman, but I have some in my car.
Oh, is it not out yet? It's not out? What the fuck? But they were like pushing it so hard, like at the symposium. Yeah, they've been saying that for years, but
It's been 5 years.
but at the symposium, wasn't he gonna be in town to like promote it heavily and?
He was here right after the symposium.
Pardon?
He was here right after the symposium.
And didn't he like push it or sell it or pimp it?
Very close.
And no one got copies.
It's like Donald Rumsfeld, right? I don't know how, I don't know when, but something awful is gonna happen. I don't know, but anyway, what I wanted to say actually, because I saw one of the advanced, like the early copies of it when they were, you know, and anyway, it doesn't matter. I just wanted to show you a mistranslation, but it doesn't matter. It doesn't matter. There's like a passage there that I thought his translation was pretty much off, but it doesn't really matter. Good. Second thing is going to be when I did my research on the Decoction Classic, right, and I looked at different aspects of those Han Dynasty herbal works. And I did a lot of comparison also with, for example, the Ben Cao Jing and things like that. Then you always see the concept of heaven, man, earth reflected, right? In herbs, in acupuncture, heaven, man, earth is the three talents in which you needle depth, right? In single herbs, heaven, man, earth is the three classes of the herbs, right? Upper class medicinal, middle class medicinal, lower class medicinal. And so the same for the formulas, right? Upper class, middle class, lower class. So basically, here also there's this kind of three levels of illness going on, right? So first here you have three rules of illness. First rule is channels receive the evils, right? And then it enters the hollow organs or the solid organs due to internal reasons. So whatever the internal milieu decides, you get an external invasion, it starts at the channel level. But due to whatever your internal conditioning is, it might travel to wherever you're weakest, right? Might affect where you're the weakest. So that's the first type. The second thing is illnesses diseases that can transmit from one place to the other internally. Right? So the four extremities, the 9 orifices, they all transmit mutually via the blood vessels. So everything is connected via blood vessels internally, right? And so if you're struck externally due to some whatever illness, internally those vessels and those areas and those tissues and so forth will congest and obstruct, right? So this like a the first thing is the causality, which is like, boom, you get something on the outside. The second part is that internally, things go from one place to the other, and one pathology of one place can affect another place, right? And then the third level is, of course, all these other kind of miscellaneous conditions where, obviously, here you see sexual activity, being cut by a knife, damaged by insects, damaged by animals, poisons, all those things. Right, those are the purely non-internal, non-external causes. So it's kind of like a colloquial description of purely external causes, internal causes, and non-external, non-internal causes, right? I mean, again, I'm with you when you would say, well, Arno, why didn't he just write that a little bit more clearly, like external, internal? You know. Well, why was the aging not written in bullet point format, right? I mean, okay, that's because the language seems a bit weird, but that's because we're not used to reading texts of that era, so that's why it kind of strikes us as weird. Same thing here, a little bit of advice by Zhang Dongjing, right? Nourishing carefully means that you have to like constantly make sure to maintain your health, make sure that your channels and collaterals do not get disturbed by wind. If you get struck by wind, make sure that it doesn't transmit to the organs. Make sure you get treatment right away. I say this all the time, right? Don't let it go from the yang conformations to the yin conformations. Make sure you catch it when it's still at the yang conformation stages, right? If your extremities feel heavy, do some exercise, right? Do some breathing exercises. Get acupuncture, get moxa, rub some fat on you, you know, which is massage, right? The old name for massage, right? I mean, this is actually what we're doing, though. I mean, you get massage oil. It's nothing but fat. I mean, it's just some fat on you. It's not like pig fat or anything, but don't let the orifices close off. Don't let the hollow organs close off, and so forth and so forth. Then he says, also, don't commit crimes against the law, because that's actually very unhealthy. It might lead to lacerations at the level of the neck, especially in those days, right? Like guillotine. Don't get damaged by animals. Definitely don't get damaged while having sex with animals. Don't eat the animal after having sex with it. I'm just paraphrasing. I'm just paraphrasing, you know. Yeah, it's just, livening up an old, boring text a little bit for us here. So anyway, so he's got all these things about, these are all things that you can do to maintain your health. If, sometimes you're going to get sick. If you get sick, seek help right away. If you're feeling your limbs are heavy and your power is weak, do some exercise, do some sport. You're hurting, get some massage, get some acupuncture. Do whatever it takes to stay on your A game. All right, stay healthy. So he's kind of giving you advice also to kind of do health preservation, which is interesting because, again, in the Shanghan, he doesn't talk about any of that. But in the Jingui, it's much more like he's got way more room to talk and chat. Right? I think how many sentences in the Jingui? 500 and something, like 580 or something like that. It's more than the Shanghan, so there's a bit more fluff in the text, right? Good. Observation. He talks about facial complexion, observation. This is not something I've learned as far as, I just know the basics. I see an off complexion. I recognize it when I see one, but it's not something I look for. Some people very specifically will try to look for it and study that and study complexion. Maybe Zhang Dongjing had something there as well. No, it's here. Yeah, it's the yin tongue, yeah. I know, it's not the tip of the nose, it's the yin tongue, yeah. If it's black, there's water qi. White means anemia, whatever. Red that isn't seasonal means, like in summer if you're more red because it's hot outside, okay, that's okay. But if it's red that is not seasonal, means your young is floating to the surface, so that might be a bad sign, bad prognosis, etc. Yellow, difficult defecation because the stomach color. Black is taxation because the exhaustion of the blood, right? We see that ashen complexion in Da Huan Zhe Cong Wan, right? The blood dries out. Kind of has like an ashen black-like complexion, and so forth. So bright reflective means there's residing room. For example, Fang Ji Huang Qi Tang, Dr. Tian would always say that the swelling in the face, the skin is taut, and it's reflective. It's almost like it reflects the light because the skin is so taut, and there's so much moisture in the skin, so it's very shiny, right? So that would be that there's room in the body and so forth. Same thing here. He talks about the different types of the sound of the voice, right? Whether the speech is dull, whether the speech is thin and chirp-like, whatever, there's all these different things. Not anything that I have personally been introduced to in clinic per se. I mean, I think we all have our different kind of general ideas about it, and we see something when a patient comes in, like that. Obviously, they're probably in pain, right? I mean, but doesn't mean that I know much more about it than that. But it seems that Zhang does say that you have to use all these different observation skills, right? While in the Shanghan, it's just like pulse. But here you gotta fire on more than just that one cylinder. You gotta have a few extra techniques up your sleeve, right? So sometimes, a lot of lines actually, not sometimes, a lot of lines in the Jingui, it doesn't mention pulses, right? There's a higher percentage of lines in the Shanghan where pulses are mentioned than in the Jingui. A lot of lines in the Jingui, there's no pulses mentioned, right? So then, what that means is that you might rely on other diagnostic techniques, first of all, right? Abdominal diagnosis is a good one, right? But also good questioning is another one. But also some lines doesn't have a whole lot of symptoms mentioned, right? So then some type of elimination is another way of diagnosing, right? I've given one formula, it didn't work, I'll just use the next one in the chapter. It seems to be that that's one of the advices. Sometimes he said, this formula treats difficult urination, blah, blah, blah. And then there's Hua Shi Bai San and Pu Hui San and Fu Ling Rong Yan Tang and for difficult urination. Basically, he's saying, well, these all treat difficult urination. And if the other ones didn't work, you might want to try one of these. No pulse, no signs and symptoms, no nothing, right? So just try it. So it means also that in Jingui diseases and for the prescription of Jingui formulas, and this is of course dangerous when I say this now, but I need to say it anyway, is that it is more allowed to prescribe without pulse information. What I mean is that when you're not able to really read the pulse information, you're like, I don't know if this pulse would fit this formula. But all the signs and symptoms do fit the formula and fit the pathology. In the Jingui, it would still be allowed to go ahead and prescribe that formula. In the Shanghan, no effing way. In the Shanghan, it is so strict. Because in the Shanghan, things can change every hour. So that's, there's way too much volatility. You gotta be strict. No Chaihu pulse, don't prescribe Chaihu. Right? It's strict like that. In the Jingui, it's different because the pathologies, sometimes they go over 15 days or 30 days or 60 days. Sometimes the timelines mentioned are way longer, right? If there is a deterioration of the joint, deformation of the joint, that didn't happen overnight. That stuff could have been years in the making, right? So that, like deficiency taxation, that's years of overwork, years of taxing lifestyle. Doesn't just happen overnight, right? So then you can go less with the pulse and more with signs and symptoms as well. Now, the beauty of you guys all being here and I'm being able to offer a Tian family system is that the Tian family has pulses for most of the stuff. But even the Tian family doesn't have pulses for every formula. But, there's not that many missing. So maybe of the about 300 formulas, I'm thinking maybe there's about 40 formulas or so that we don't have primary information. Now, Tian might have had the information. It just didn't get transmitted to my teacher, and we don't have a written record of it because he never really systematically taught much, right? So, but I strongly believe, and has been my experience now of working with the system for the last 14 years, 13 something, right? It's the 14th year that I'm working with this system exclusively, that as you learn the system and as you get good at it and familiar with it, with how to take the pulses, how to interpret the pulses, you are able to fill in the blanks even just by yourself. You're able to come up with pulses for certain formulas that you'll try. Oh, you're like, would it be this? It kind of fits according to the pulse, right? But by basically that you understanding the pulse theory, you give the formula. Oh my God, it worked. Okay, I'm gonna write that down. All right, this might be a valid standard pulse for this formula. Next time another patient comes in, you got this pulse, you're like, let me give this a try. Boom, it worked again. Okay. After a while, you've got a sample size that's large enough, you're able to draw conclusions and you're able to start standardizing more pulse patterns for formulas. because you're in the system. You know how to think, you know how to analyze. And then, of course, later, when you all have your own students, you can start to say, well, my teacher never taught me the pulse for this formula, but over my years of practice, you know. That was my Sean Connery. That wasn't a good Sean Connery. My years of practice, I have found out that this pulse works the best. Yeah, something like that. So, so you can come up with different pulses, and it's all part of the system. And that's because this is a live system. It's not a dead artifact. It is a live system. And the more students I have, the more the system will grow. That's the beauty of it, right? Because more brains using it in clinic, thinking about it, more feedback in clinic. I cannot see enough patients in a lifetime. It's impossible. Tien saw so many, and still even his wasn't complete. His research wasn't complete, you see? So the more people, the better, right? So it lives, and it'll keep filling in the blanks. Let's take a little break first.